My name is Mohammed Iqbal Abdul Aziz Baloch. My age is 73 years. मेरे को बहुत कोल्ड हुआ था तो मैं डॉक्टर को दिखाया तो डॉक्टर ने फिर चेक किया और बोला कि आपको चेस्ट में थोड़ा वॉइस आ रहा है.
Hi, I'm Dr. Pradeep Haranahalli, working as consultant cardiologist with Manipal Hospital Whitefield. Mr. Mohammed Iqbal, 74-year-old gentleman, he reached out to us few months back for his repeated symptoms of dizziness and near fainting episodes. He had blood pressure for many years and was taking medications. He was recently detected to have Parkinson's disease and was initiated on medications. We evaluated him for his symptoms and we diagnosed that he was suffering from severe aortic valve stenosis. So it is a cardiac condition in which one of the valve called aortic valve is severely narrowed and dysfunctional, not functioning properly. So it does not let adequate amount of blood to come out of the heart and reach all the organs. So that is when patients start manifesting with symptoms of dizziness, fainting episodes, feeling breathless, sometimes even chest pain as well. If untreated, these conditions will have a progressive downhill course and ultimately life-threatening.
तो फिर आप एक बार इको कार्डियो करवा लो. फिर मैंने इको कार्डियो करवाया तो उसमें जो वाल है वीक आया, क्लेसिफाइड वाला आया. मेरा लड़का है, उसके जो फ्रेंड है उसने फिर बताया कि आप डॉक्टर प्रदीप हरनीवाला सर को एक बार कंसल्ट करो. हमने मणिपाल हॉस्पिटल या व्हाइटफील्ड में आकर डॉक्टर साहब को बताया. फिर उनसे कंसल्ट करते हुए पता चला कि आगे की प्रोसीजर थोड़ी करनी है और आपको वाल चेंज करना पड़ेगा. तो हमने फिर उस पर पूरा भरोसा किया. बहुत अच्छा डॉक्टर है, एक्सेलेंट है. उसकी बातों से हमारे को भी कॉन्फिडेंस आया और हमने सोचा कि करवाना है तो डॉक्टर प्रदीप सर के पास ही करवाएंगे, जो भी करना है वो. फिर उन्होंने जो आगे की प्रोसीजर थी वो हमको बताई. तो स्कैन करवाया, फिर अलग अलग टेस्ट करवाए, ईसीजी, फिर वापस इको करवाया. उसके बाद एंजियोग्राम कराया तो पता चला कि तो एक नर्स में 70% ब्लॉक था.
Typically, aortic valve stenosis requires most definitive treatment, which is aortic valve replacement. After due discussion with the family, in order to facilitate further definitive treatment, we went ahead with plan for doing the coronary angiogram. Upon completing coronary angiogram, we also found that he had critical blocks in the left main coronary artery, adding more worries to the valve problem which was already diagnosed. Typically, such blockages in the left main coronary artery are dealt by either bypass surgery or by performing complex stenting procedures. Mr. Mohammed Iqbal was fit and fine all his life to have had broken coconuts with bare hands. He lived all his life surrounded by his extended family under their love and affection. This was first instance in his life and in his later ages to be diagnosed with such critical cardiac conditions which requires extended treatment. It was a matter of intense concern for himself as well as his family, who for the first time coming to know about such critical cardiac conditions, and Mr. Mohammed Iqbal had not even spent a single day in the hospital throughout his life. With these concerns, the family was keen on seeking our help in finding the best possible treatment option with minimal invasive nature as well as less time spent in the hospital.
तो बोले कि अभी डायरेक्ट अपन वाल चेन नहीं कर सकते, पहले उसको रिपेयर करना होगा. तो हमने पहले स्टेन का ऑपरेशन करवाया डॉक्टर प्रदीप सर के पास. उसके बाद उन्होंने बोला कि 1 महीने के बाद वाल का रिप्लेसमेंट करेंगे। तो 1 महीने के बाद वापस हम उनसे कंसल्ट किया और फिक्स किया कि कौन से डेट को क्या करना है, किस तरह से करना है, वो सब कब एडमिट होना है। फिर उन्होंने 8 तारीख को ऑपरेशन किया हमारा, 8 नवंबर को। उसके बाद 3-4 दिन में हमको हॉस्पिटल से छुट्टी दे दी।
Mr. Mohammad Iqbal, for his conditions, requires a valve replacement and procedure to treat the blockages in the heart. Replacement of a valve can be done by 2 methods. Traditionally, conventionally, it has been a surgical approach to replace dysfunctional valve, and the newer technology or advanced treatment is replacing the valve by a procedure called TAVR, which is a transcatheter replacement of aortic valve. And the blockages in the heart, that is in the left main coronary artery, are traditionally managed by bypass surgery procedure. However, it can also be managed by complex coronary angioplasty and stenting procedures. Here the situation is Mr. Iqbal is requiring both procedures at the same time, that is to replace the valve as well as treatment of the blockages. So here comes a scenario: either he will undergo a total surgical approach involving surgical aortic valve replacement along with bypass surgery, or he undergoes a total minimally invasive procedure involving transcatheter aortic valve replacement along with complex coronary angioplasty and stenting procedure. After thorough discussion with Mr. Mohammad Iqbal and his family about pros and cons, merits and limitations of each approach, that is surgical as well as the non-surgical, we did a meticulous planning involving the family and came up with an approach. In this, we initially performed an IVUS guided complex coronary angioplasty stenting of the left main coronary artery using drug-eluting balloon, and then subsequently he went home on the 3rd day. After recovery and stabilization for 4 weeks, he came back again, got admitted and underwent a TAVR procedure, that is transcatheter aortic valve procedure, and again he was discharged to go back home on the 3rd day. So by this approach we could achieve an excellent result and outcome by 2 short hospital stay, performing procedures under no anesthesia with quick mobilization, shorter procedure time and a shorter hospital stay with quick recovery to normalcy. However, in contrast, a surgical approach would have involved a general anesthesia, a prolonged surgical time and extended hospital stay spanning maybe up to 7 to 10 days with ongoing recovery and delayed recovery to normalcy.
अगर उनका ऑपरेशन में हमको बहुत सेटिस्फेक्शन मिला है, वो जब ऑपरेशन करते रहे तब भी हम एकदम अच्छे से फील कर रहे थे, कोई तकलीफ नहीं हुई थी। बहुत अच्छे से काम किया उन्होंने। मणिपाल हॉस्पिटल में जो डॉक्टर है प्रदीप हरनीवाला सर, उनसे ही सब कुछ करवाया A to Z। आई एम टोटली सेटिस्फाइड। थैंक यू।
Thank you.